is the role of nurses really in childbirth? Are we seeing nurses perform their duties responsibly?
I think to a large extent, just to make a little distinction, when it comes to childbirth, it's the midwives that do the greater part of the work. But nurses are also trained, realizing that we do not have enough midwives. By the training of every nurse is a requirement. You know, every nurse is taken through what we call obstetric nursing, where you do everything that the midwife is taught to do. The midwife is taken through the period of antenatal, then through labor, then what we call puerperium. That is a period after the delivery. And so nurses are also trained through what we call the obstetric nursing period and given practical sessions through antenatal, through labor, and what is expected. So to a large extent, yes, there are a few people who may not do exactly what they've been trained to do, yes, but largely when nurses have the opportunity, they do what they are supposed to do.
Okay, and so what do you do? Are you a nurse? You're a nurse. Yes. Okay, and for most people coming to the hospital, they come in with different challenges, okay, different health conditions. Which one would you say tops the list? What is causing most of these problems?
I think mostly these days, women tend to be bleeding even when they are pregnant, so which is something that is really most common.
What is causing that?
Several factors can lead to that, and in the course of the pregnancy, that would mean that blood may be coming out. It may be that the placenta is pulling away from the uterus prematurely when it's not time for that, and so the woman tends to bleed. We have other causes such as infections also. Usually, some pregnant women would douche when they are bathing, which they are not supposed to do. The moment they do that, there might be some particles or bacteria which they introduce into the place, and that causes the infection.
Okay, so don't douche when you're pregnant.
Okay. Oh, wow.
Very simple, but important. Anyway. You shouldn't be douching anyway, but I'ma come in here.
Ladies, childbirth. I'm getting all excited about it. Just in Ghana, how many women do take up the antenatal route? Because they do advise as soon as you're pregnant, go, antenatal. But let's be honest, most women in Ghana don't. But just in terms of any statistics, how many people are doing it, and how you can encourage more women to go through so they know exactly what they should be doing and preparing for birth.
The statistics would indicate that you have more than 70% of women going for antenatal care
across the country.
But it's the consistency when they start, because it's expected that every woman, the moment you realize you are pregnant, just contact your health worker so that the person starts monitoring your health and the baby's health. But some women would wait until they are close to delivery because they do not want to come to the hospital, and then the midwife scolds them that you did not come for antenatal care. They would go and get their cards so that when they come in labor, it shows that they came for antenatal care. But some will not go as expected. So that is one of, because it's when you go that you have the education as to what you should do. They are monitoring, the pregnancy, the baby's health, and that kind of thing. So you have a lot of people coming as registrants at antenatal care, but the problem also comes when it comes to delivery. You have fewer numbers coming for delivery in the health facilities as compared to the number that comes
for antenatal.
Are they delivering at home? Yes. You have people delivering at home. There are several reasons for that. It could be that some are far from the health facility. Labor does not inform you before it starts. Sure. You just have an idea. My doctor says that or the midwife says, my expected date is this. But they could come 2 weeks before or after or any day between that period. It doesn't inform you. So there are people who maybe the health facility is not situated near where they are, but with antenatal they can manage, take transport, get there. But when it comes to delivery, in the very remote areas where they do not have the midwives, then people would deliver. And others have some interesting things. Yes, I will present myself for antenatal, but for delivery, no. Some cultures would not.
How rampant is that?
That is rather common in the very remote areas, and depending on the level of education they have had and the illiteracy level, sometimes some cultures are so entrenched, even people could have had the education and all that. Well, there are others who would say maybe the midwives and the nurses are nice during the antenatal period, but when it comes to delivery, or they expect you to bring certain things during labor, and
they're not exactly nice at that time. Abigail, is this true or false?
That's true.
The nurses are not exactly nice. I mean, we have some very fantastic nurses in this country.
Yes.
And for about 90% of them, they do a splendid job in the hospitals.
Exactly.
But of course, you come across that nurse who is probably not having a very good day, and so will take it out on the mother. Are the mothers expected to know exactly what to bring on delivery day?
Oh, definitely. Once they are pregnant, they are given a sheet which has what they would require for themselves as well as the babies. And they are advised to buy this in advance and even pack them in a bag so that the moment it starts, they just don't need to pack all the things. They just pick their bag and then straight
But you
on
don't
to-
see that often, do you?
You know, as Ghanaians, we always want to wait for the
Last
last
minute.
minute.
On that note, actually, I witnessed a birth once. I was actually preparing for a movie role, and I went to go and view a childbirth, and it was actually very nice to watch.
Exciting.
Yes, if you want to use those words. But I remember the hospital was pretty stretched where I was, and there was one midwife to about, it was a night delivery that I witnessed, to about...
The ratio is not very good.
It wasn't good. I think there was about at least 20 women there. And I was very lucky. Within a couple of hours, I managed to see a birth and I was able to go. However, you could tell the midwife was just, she was not in a good mood. Very
She's
stretched.
tired.
Yes, I remember there was a young girl who was giving birth and she was screaming like, oh, I just know. And she was like, hey, and I was like, oh my goodness.
Mrs. Bam, is that a good attitude?
Is that a good attitude?
It is
to
not
have?
at all. It is not, and professionally you are not trained to do that, you know. But as she said, sometimes with the
Yes,
numbers,
trust.
the ratios,
One woman.
you
It
know,
was one woman.
there
And
are a
she's
lot
older
of
lady
what
as
we
well.
call one woman or one man stations, where it's only one midwife, which is to a catchment area. So sometimes you have a few of them, even in the bigger hospitals. You have people coming, the numbers are high. The number of midwives dropped at some point because we had various programs training midwives and things like that. So you have a few instances like that where people
I will also
school
add though,
them
she was
in the-
amazing when it came. When I watched it, she delivered the baby on her own. She was amazing. She was like, during birth, she did her job. And the funny thing is, she was almost doing it like methodologically, because it was very boom, 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 boom. She was hardly talking to the woman like, okay, push, push. Because you can tell she's an older lady. She's probably delivered thousands of
Hundreds,
babies
yeah.
in her life, and there was no vim left in her. In terms of nurses, where you're supposed to make somebody, even healthcare professionals, make people feel at ease, you know, and Ghana, we're very stretched. How can they keep the attitudes nice at all times? Because you're supposed to be nice to patients.
Abigail, I think you should take this one out. Abigail, you are the nurse here. Take it out.
I know, but sometimes as human beings,
human,
and
yeah.
Have you ever done that?